Hello. I just wanted to come back to you with some updates on my breast reconstruction after I had my bilateral mastectomy due to breast cancer. I have had six fill-ups in my expanders, and for those of you who don't know what those are, I've talked about it extensively in my previous videos. Please feel free to watch my video on breast expanders, and I do explain that a little bit more there. But I just wanted to talk about that. I'm at 310 cc's, and I've learned a lot about that in regards to breast size. Um, I think that's about a low B cup. That's what my doctor was saying, anyways. And just to give you an idea of what that's at, and keep in mind these are expanders, these are not the permanent implants. So, it looks a little different. I do have some definition, with the 310 cc's. Starting to feel a little more like me again. Starting to be a little more comfortable in my body. I am looking forward to being done. I think I'm going to go in for one or two more fill-ups, and then we'll see, how that's looking and how I feel about it. Silver lining, I'm actually kind of excited to be a smaller size. I was a 42 double D before, and I was very uncomfortable with that. It just wasn't really me. They just weren't going to stop. I know this is a strange thing. I didn't even realize that this was possible, but for some women, they do just keep growing, and it's caused by hormones. Our estrogen, mostly, I believe, and progesterone contribute to the growth of our breasts. And it was shocking for me, the past 13 years. I mean, yeah, I had some children, I've had 7 pregnancies. But, 3 live births. I've really been down a journey there as well. But genetically, I guess I just got hit with, the never-ending growth. And I really thought that when I had them removed, there was going to be like all this fatty tissue that they were removing as well. I was really surprised to find out that there really wasn't a lot of fat in my breasts that was removed. I thought, well, I'm going to lose like 10 pounds, having my breasts removed. No, in fact, I didn't really lose any weight having them removed. It was very minimal. And everything they removed really was breast tissue, for being a 42 double D, I really thought a lot of that might be fat. I don't know why I was thinking that. It just seemed like it would be. I've lost weight in the past. Like I, have really struggled with my weight as a result of, well, bad habits and having children and just circumstance, just life, being busy, being a mom and a wife. I haven't, had a lot of time for myself to work out and take care of myself in that way. I think a lot of us can relate to that. You're busy, 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 yet somehow that weight just likes to stay there. It just doesn't want to go away, no matter what we do. So I really thought that I just had all this fatty tissue along with my breast tissue up there. But no, it was really mostly all breast tissue. And in my case, I talked to my doctor about that. At one point, even before my breast cancer, I was noticing that I just kept growing. Like every year they wouldn't stop, even though it's been 5 years since I had any children. They just wouldn't stop. And I asked my doctor about that. I said, can they keep growing? And he said, yeah. It's not common, for them to, keep growing like forever. But it's also, not unheard of that a woman's hormones could cause them to continue to grow. He said usually in a case like that, we do recommend a breast reduction. So, in my case, we were just kind of watching the situation, but I went up 2 sizes within a year. And I don't know if that condition has anything to do with why I developed breast cancer in the first place. You could literally go mad trying to pinpoint exactly what caused your breast cancer. Um, in my case, I was estrogen and progesterone positive. He did say that, I mean, it really is mostly the estrogen that the cancer feeds on. So mine was not genetic. I do recommend getting the genetic testing if it's offered to you. Absolutely, it's good for posterity to know, I think, as well. I'm a big believer in, the science behind that stuff, and I do believe we will eventually have more, answers and results and, progress with cancer treatments as we, embrace the different scientific, studies regarding breast cancer. So absolutely, get your DNA, tested. I was negative, for the BRA1 and BRA2 genes for my cancer. So it was, hormones, mostly hormone receptive stuff going on there. But it would be interesting to learn, more about that. However, breast expanders. I'm at 310 cc's. I've had 6 fill-ups in my expanders. And as I've mentioned before, if you don't know what those are, I did talk about it extensively in my breast expanders video. If you want to go back and watch that and learn more about it. These are not my permanent implants. This is just basically while I'm healing from my mastectomy. These expanders were put in at the time of my surgery. And I've had to go in, for fill-ups. It's a saline solution that they inject into them. It doesn't hurt, it can be a little uncomfortable, but it's not bad. It's really not. I'm really impressed, with where I'm at right now. 310 cc's, my doctor said that's about a low B cup. So not bad. I'm probably going to have 1 or 2 more fill-ups, and we'll see, how comfortable I am with that at that point. If I like the way it's looking, then I'll probably go ahead and have my final surgery. But I'm making these videos because I really want to try to help make other women more comfortable with what's happening with their bodies. It is scary, to get diagnosed with breast cancer. I was so scared. I didn't know what to expect. And it was really helpful to me to watch other women's videos going through their cancer journey. It helped to comfort me. It helped to give me hope, and to see that these women have been making videos for a number of years as they are healing and, making the choices they're making for themselves to emotionally heal and spiritually heal. And they're sharing their experiences has really helped me. And so I wanted to share my experience as well in the hopes that, it will help, someone else out there. And if you're just facing this, if this is new, I just want to let you know that there is hope, and, everything's going to be okay one way or another. There is hope, and, there's incredible science and incredible strides in breast cancer treatments and, to help women through their healing process. And, once again, if you choose a mastectomy, you're losing your natural breast, but look, there's hope. Breast reconstruction is, it can be a little rough, but it's really not so bad, you can get through it. We can get through it. We can get through this. We're strong. Women are strong. We're so strong. And I'll keep posting updates on this. It's been weird going to my doctors, with this whole COVID-19 thing. I'm going in there with my masks, and, they're wearing their masks, and my appointments are far and few in between at this point. I've got to wait another week, so I'm not going in this week, but I'll be going in the next week. I think they're getting kind of antsy. I think their office is, pretty cleared out. A lot of, plastic surgery there's a lot of non-essential, but there's also, of course, essential patients, like cancer patients who need plastic surgery services. And so I think that they're down to their most essential patients right now. I don't think they're even taking new patients for other services at the moment. And so I think I'm feeling that from my doctor and nurse. I mean, they're, of course, wanting me to be happy, with my results at the end of my final surgery. But I think they're also feeling antsy to kind of get their essential patients taken care of, so maybe they can close up shop a little bit more for a little while, and take care of themselves and their families and reduce their risks. So I completely understand that. But, maybe it sounds selfish, and some people might think it is, but, you can't keep expanders in for super, super long. There is a limit. You do hit a point where you got to get those out. You got to get your permanent implants in. If you could go too long, I'm not sure how long it is. I think it's like a year, like is too long, to have expanders in. You really want to try to get things done and out within like a 6-month period, I think. I really think they try to shoot for like 3 or 4 months, like somewhere in between there, like from the time you've had your surgery to the time you're done with your reconstruction. They really want to fit that into, I think, like a 6-month period. It's a safety issue, but because you can increase your risk for infection and problems with the expanders like leaking, and deflation and problems like that. So I think they're hitting a point with me where they're really wanting to get done with you, just because of the climate right now, the economic climate and the health climate right now with the pandemic. And I totally understand that. And they're like, you're a low B, that's good. That's, if you're happy with that, we can stop there. But I admit I'm not going from a 42 double D to a low B, it's still kind of emotionally, this is the rest of my life we're talking about. So I got to be happy, with what I've got to help with my emotional healing from this trauma. So I think I'm going to shoot for, 1 or 2 more fill-ups, and, hopefully, I'll be happy with that, and I'll be able to have my surgery. And I will keep you all posted. I've let this video run a little longer than I originally intended. I'm sorry. So I'm going to go. But please, if you're enjoying my videos, if you have any questions, I would love to, answer any questions any of you might have, about, my journey, my process, everything I've gone through. If you've got questions, maybe I can help out. Please feel free to ask. Also, if you're liking my videos, subscribe, hit the like button, and I will talk to you later. My prayers are with you, and I mean that. I really mean that. My prayers are with you all, and I love you guys, and I'll talk to you later. Bye.